Evimed OIS is a flexible oncology information system. Every physician can utilize the features according to their individual needs. You can immediately retrieve a list of patient-matched recommendations once you have entered your patient's basic details and the type of cancer. However, you can filter the recommendations furthermore by entering your patient's parameters, and I'll show you how. Disease-specific parameters describe data that are characteristic of the cancer, such as tumor size, receptor status, chromosomal irregularities, relapse status, and gene mutations. Common parameters contain all other data that describe the patient in general, and this includes functional parameters such as hepatic and renal function, previous and comorbid disease, pre-treatments as well as current treatments, and pregnancy. Conveniently, all parameters that are entered and changed will be labeled with a proper date. This will keep track of parameters in chronological order and identify which ones are still needed. Now let's go to our patient Sarah, and I will demonstrate how to add parameters to her folder. I can record that she is HER2 positive, estrogen receptor positive, and note that the labels positive and negative will only be used for parameters that can be distinguished by positive or negative. The material here describes where the parameter is found or how it is related to the patient. And these disease characteristics are related through the material tumor. Now that I've saved this data, I can enter some common parameters. Note here that you can identify the material of the parameters as well, and quantitative values of blood and urine content and life expectancy in the values column. Now, I can record that she has a thrombocyte count of 150,000 per milliliter, and this is related to the material peripheral blood. Next, I want to show that she has good hepatic function. And this is in relation to the material body. I will label this positive. Next, I want to mention that she has good respiratory function. And this is in relation to the material body. Again, this is labeled positive. And she has also experienced a myocardial infarction. And this has occurred in the material body. Again, this is labeled positive. Sarah has also had a pre-treatment with anthracyclines. And this is a pre-treatment, so I'll label it appropriately so. And I'll also label this positive. Sarah has a creatinine clearance of 2.08 milliliters per second, and this is in relation to the material urine. Next, I want to show that Sarah is pregnant. And this occurs in the body. Again, I'll label this positive. And next, I want to show that she has good cardiac function. And this is in relation to the material body. This is labeled positive, and I save this data here. And so once you've entered all of your parameters, you will see that your recommendations are far more tailored to your patient's medical profile. You can see open clinical trials, published clinical trials, as well as guidelines. Now you can provide personalized cancer care with Evimed OIS. For more information, please visit us at www.evimed.com or email us at info@evimed.com.